Let's talk about the top 5 causes of death in the US. Can you guess what number 1 is? You might be wondering, why should you care about this topic? Chances are that if you're not at risk for these top 5 diseases, you likely know someone who is. At a time when Americans are living longer, it's important to have a good quality of life as we age. This inevitably means learning to recognize anything that could compromise your quality of life or your independence. I'm HSquared MD. Welcome to my channel where I bring you short, informative videos on relevant health topics. As always, please note that this is informational only and should not replace your healthcare provider's advice. While I am a doctor, I'm not your doctor and don't know your health history. Coming in at number 5 is chronic lower respiratory disease. These are lung diseases like chronic bronchitis, emphysema, and asthma. They can get worse over time and cause symptoms like shortness of breath, wheezing, cough, etc. You can help yourself and your loved ones by focusing on preventative methods such as quitting smoking and reducing your environmental exposures. Try to eliminate your exposures to dust mites and mold as much as possible. And these are just a few examples of things that you can do. Number 4 is cerebrovascular disease or stroke. Risk factors for stroke include diabetes, high blood pressure, tobacco use, high cholesterol, and such. Addressing these underlying causes can reduce your risk for a stroke, so make sure you are aware of your risk factors and talk to your doctor about appropriate management based on your age and other comorbidities. Focus on establishing a healthy lifestyle with regular exercise and a well-rounded diet. Number 3 is an overlooked one, and it's accidents, such as motor vehicle accidents, drowning, poisoning, falls, and so on. The good news is that this is an area where there's a lot of room for improvement. Teach your children about bike safety, water safety, and make sure they can't get into your medicines. Wear a seatbelt when driving and be an otherwise safe driver. Make sure you don't have anything at home that an elderly person or a physically impaired person can trip and fall on. Alright, so we are getting close to the top number 1. Number 2 is malignancy or cancer. Risk factors include family history and preventable measures such as tobacco use, environmental exposures, alcohol use, certain infections, and even a poor diet. Talk to your doctor about getting help with quitting smoking and reduce your risk factors as much as possible. This would also be a good reminder to get all of your routine age-appropriate cancer screenings such as colonoscopy and mammography. Think about getting your HPV vaccine if you haven't already done so and you are still eligible. Okay, so we have reached the last one. Did you guess what number 1 is? It's heart disease. This is what is harming the health and well-being of Americans and in fact people all over the world. And the risk factors are something that you have already heard. High blood pressure, diabetes, high cholesterol, tobacco use, poor diet, and inactivity, to name several. Are you starting to see the patterns? Tobacco use has such a negative impact on our health in so many ways, as do poor diet and inactivity. So get moving and get at least 150 minutes of exercise per week. Get your regular checkups and screening. Well, that's all I have for you, and I hope you learned something new today. Thank you for watching. Check back for more videos, and remember to like, comment, and subscribe. See you in the next episode.